Hi, everyone. This is take 2 on the risk reduction subcommittee intro. Today, we are here to talk about live programs in action. I'm going to cut the introduction a little bit shorter. Just a couple of high points. We are talking again about Wisconsin and Georgia. They are clearly standouts in the land of caring for those that are our constituents across the board. Today, we're going to be talking about bringing to life programs at the community level through Department of Health efforts. We have 2 speakers with us. From Georgia, we have Elizabeth Head from the state of Georgia. Liz is the Deputy Director of Injury Prevention for Georgia Department of Public Health, where she oversees injury prevention and coordinates the BOLD grant from the CDC. Then we will hear from Megan Marmel, a public health strategist in the village of Greendale, Wisconsin, where she contributes to several initiatives, including serving as the lead for the Alzheimer's Association's Roadmap Strategist program under the Healthy Brain Initiative. These conversations really bring together a series that we have been doing with the Risk Reduction Subcommittee, where 2 years ago we talked about programs that were going on at the community level. Last year, we focused in on clinical trials on programs and risk reduction related activities and research studies. Now, this is really bringing to life evidence-based programs that are happening at the Department of Health level. So I'll turn it over to Liz, then we will go straight to Megan, who is online, and then we'll have time for questions after that. Thank you.
Good afternoon, everyone. Thank you so much for the introduction and for the support from Alzheimer's Association and HHS for me to be able to be here today and represent the great state of Georgia. We're going to talk a little bit about dementia risk reduction. You may have heard a good bit about Georgia today. That's okay. I'm going to tell you again. We're a little repetitive, and that's by design. We want folks to learn about us and the great work that is happening in our state. So we're going to talk about our state first. We are 159 counties. I promise not to quiz you on that, but we are a decentralized state, friends. And so that means in our 159 counties, which earlier when Stacey Hanna was presenting, you saw that divided up by area agencies on aging. We have 12 in our state. We really like to divide things in Georgia. We've got 18 health districts. We've got, I think, 11 EMS districts. We've got districts from every other kind of group you can possibly think of that I won't bore you with, but when we do our programming, we have to consider what groups are in every single one of those districts. And on top of that, we have to think about what we're looking at. So we've got 118 of our counties designated as rural or with populations below 50,000. That changes in terms of what sort of capacities we have available in those areas. And we want to keep that in mind for our programming. In 2022, and I have not been able to find a more recent number, we only had 100 practicing geriatricians. So we need a huge increase in our workforce. We have, as everyone already knows, our caregivers have chronic conditions. A third of them or more have depression. We're providing hundreds of millions of hours of unpaid care for persons living with dementia. That is the second highest in the nation, thanks to the Alzheimer's facts from 2023, I think. And we use Burfus, which is a great resource. Folks are really reporting confusion and memory loss in that age range of 45 to 54. And that's of great concern to us in our state as we figure out where our buckets of time, money, and overall resources need to go. In Georgia, we have a public-facing data website out of the Department of Public Health called OASIS, or Online Analytical Statistical Information System. There might be, is there a thingy here? Yeah, there's not. Okay, so in mortality and morbidity, you're going to see 2 columns. At the bottom of the right-hand column in that section, you're going to see a little area called Alzheimer's disease and related dementia. So it is a very baseline sort of data area. And the reason why I'm talking about data when we're talking about risk reduction is because I want to know where in our state we need to focus our resources. So what we have done is take a look at the prevalence of chronic conditions among folks that have dementia as an underlying cause. On the map in front of you, you see both diabetes and hypertension divided by hospital and ER visits. Your diabetes is in that pretty orangey yellow color, and hypertension is in the darker sort of midnight blues and purples. So this is going to help us out understanding where our issues are. We don't just talk about this amongst ourselves in public health. We are talking about this with the Georgia Alzheimer's and Related Dementia Collaborative. We are teaching them to read this data if they don't already know so that they can better plan their programs. As Stacey Hanna's team is gearing up in the respective areas and building up their coalitions, we are helping to provide them with data so that they have a sense of where they might want to build a coalition, where a coalition already exists that they can tag into, and then among the area where they are working, where can they focus in their efforts? We aren't just talking about diabetes and hypertension. We're also talking about stroke and falls. All of the data on these two slides are from the year of 2021, specifically, again, looking at that model of hospital visits and ER visits across hospitals, across stroke in the orange and falls in the lighter purple area. So lots of places for us to do the work when we're thinking about chronic conditions. And we need to know this because we want to hit folks younger than the age of 65. It's too late by the time you're 65 to really significantly reduce the risk of developing something. Certainly take care of yourself, but we might have a better chance if we start sooner. Switching gears a smidge, GUIDE, Georgia's Alzheimer's disease and related dementia collaborative within our state. We've been working on this for a minute. Really a lot of great support from the governor level in the state of Georgia. So we did our original signing of things in 2014. We have had a GUIDE coordinator now, as Stacey's already talked about. We updated our plan. The initial plan was we have 100 plus people that are really excited about this topic. It's all going in. Everything's going in the plan because then we can't have forgotten anything. And honestly, it was amazing. The work that was done, I don't mean to belittle the work that happened, but the work that was done on that initial planning was absolutely stunning to bring a state of that size together and do the work. But when we looked at the plan again in 2020, we're like, oh, there's a lot of stuff in here and not great ways to measure it, not a lot of specificity. So a lot of work was done at that time to really get into some narrower, more focused, specific goals and objectives and activities. And that's what we're working on now as a state, which is really important. So what does partnership look like in Georgia? Really, as everyone here probably already knows, it is absolutely an alphabet of effort. So at our state level, we have all the letters: Department of Human Services, Division of Aging Services, which acts as our state unit on aging, Department of Public Health. Yes, those are standalone agencies. Department of Community Health, Department of Behavioral, DBHDD, Department of Behavioral Health and Developmental Disabilities. So every single letter you could possibly imagine, but more important than the letters really are the communities that support us. We have an incredible amount of support from academia across our state. We have an incredible amount of support from folks living with dementia and their care partners. Very, very active in GUIDE, really giving us some direction that we're very, very appreciative of. But in all of this, it becomes complicated on who knows who and what. So we like to talk about it and find out what is the depth and breadth of any given partnership. And when a new partner comes to the table, who would they like to see at the table that's not already there? It's really important to ask that question, and that helps us get a broader set of folks at the table for us. We do have a CDC BOLD grant, Building Our Largest Dementia Infrastructure. If you're not familiar, that grant is guided by the Healthy Brain Roadmap. And so our efforts, we really try to organize under these broader categories, which has worked really well for us. And so we were funded from 2020 to 2023, and again, beginning in 23 for a new 5-year period. In all of this, our approach has been a systematic approach, being a bridge between community groups and your usual suspects and trying to bring people together. And we're going to talk about that. All of this is a lot less like the beautiful, organized, linear structure of BOLD and a lot more like an octopus. Because there are so many things happening all the time across all of these different sectors. And so our partners talk to us, we talk to them. We don't just meet to meet, but we do have quite a few standing groups that remind each other of what's happening and what is new, what is latest and greatest, who needs training, who's in charge of that training, when are these events happening, who's the new kid nonprofit in town, do they need some help in meeting all the people? All of these things are 100% foundational for us to do more with what it is that we have in our state. I'm not going to go into a ton of detail on what a dementia care specialist is. I could never do it the justice that both Kristen and Stacey did earlier today. However, what we are doing is working with our chronic disease prevention managers. There's one in every single health district in Georgia, and we are introducing them to all of our dementia care specialists so that those groups can work together and have a better understanding of what's going on in their respective worlds, trying to make the bridge between these different types of professions. Some of the work that we've done that helps to fuel our risk reduction work. This actually came out of the outreach and partnership work group that is part of GUARD. I'm pretty sure Dr. Mintz helped on this. It was really a labor of love. This committee spent a lot of time being just really, really thoughtful about what it means to have a strong brain, a healthy brain. And this was the result. And so we give this out to our health department, chronic disease prevention managers, and say, hey, friends, when you're talking about chronic disease, please put this in there. You don't have to say anything, just put it in there. It's a really low-hanging fruit that allows us to get in the door and talk about it across different folks that are already talking about other types of topics. It is a really great flyer, even though people are talking about updating it. I really don't know what you could update other than maybe some of the data that supports these sort of foundational principles around having a strong brain. Most of these programs will probably be familiar to you. Savvy Caregiver, the Great Care Partner Support Program, Alter, which is really about the African American faith-based community. And it's such an understatement of what Alter does. They go in and they talk first about being dementia friendly and being dementia capable from a faith-based perspective, but then they stay and they want to know what's happening and what the group, what that faith-based organization wants to know. And what they've started doing at the request of congregants is to incorporate risk reduction principles. To talk more about caregiving, to talk more about your own risk as a caregiver, as well as the risk for someone who you're worried about. And so we try to give them materials that they need. They've taken off and they have, I think, almost an international presence now, which is really, really exciting to look at it from a really, truly community-based organization perspective. From a public health perspective, we also do virtual dementia tour. I know that everyone's familiar about this. We've talked about it today, but when you're thinking about bringing public health into the fold of things, it's important for our workforce to understand what it means to have a day in the life of this. It's different to see it when you're responding to a call. If you're a first responder, it's different to be in a public health clinic and maybe be trying to help a family out, but that's not actually what you do primarily. So we've had great success with having public health departments lead these as part of their community outreach. Our chronic disease prevention managers are starting to do that work, which is really, really exciting. All of these programs are supplemented with a media campaign that we came up with at Georgia Department of Public Health called Think About It. These are the basic tenets of Think About It. Did you forget your way to the grocery store again? Are you lost? Are you having trouble finding the right word? Connecting, not just words, but also with people? Are you having trouble with the numbers, getting those to add up again? Think about what that is. Think about what the risks are. What is it that you can do to overcome the risks, really being solution oriented, which really boils down to taking care of yourself, doing the things that a lot of folks may not want to do, but we do have some hope. There's been a lot of great outreach around this program. In the corner of one of the flyers we have for this, it looks like a business card, and then you open it up a little bit and it looks like the letter Z. And then you open that out and it folds out into an 8.5 by 11 piece of paper that has all of this on one side and then one of those beautiful graphics on the other side. But in the top right-hand corner, there's a physician code for if you get to a care plan and what the physician could charge, what CPT code they need to use. And it accidentally, but in a great way, turned into a self-advocacy piece for families. They're taking to this physician and they say, we want the thing. They don't know what the thing is. They want the thing. They want an annual wellness visit. They want to talk to their physician. They want their physician to do the mini cog and to get them into our assessment and sort of diagnostic journey that we have. So it's really exciting to see that happening in Georgia. And it started with humble beginnings of just sort of a media campaign. One of the things we're most proud of is our partnership with University of Georgia. I'm required to say go dogs. So it's just I live in the state, friends. This is what we do. Our friends at UGA started with stakeholder mapping, really looking at local leadership. We've talked a lot today about top going down, and maybe that's not the best approach. These folks, they have a USDA land grant, and they are taking that and they're working on their relationships that they have with extension offices, which every state in the nation has extension offices. And they are using those communities to learn what needs to happen. And they're doing that with the community being the expert. So the sites you see in blue are their waiting list, because they have a waiting list, which is crazy to me. I can never get a hold of them to see if the blue ones have turned green, because they're always in rural areas and there's no cell signal. So we just wait for emails. They were planning in 2023. I do know that those 2 red sites are now green. And they're just really focusing very specifically on rural areas that have, all of our areas have extension offices, but that also have Archway Partnerships, which is a socioeconomic arm of UGA's land grant. And so they can go in there and work with those existing group and say, hi, friends, we wanted to talk about brain health. Like, is that something you wanted to talk about? And these people are overwhelmingly saying yes. And so UGA does some initial presentations and discussions, and then they host events, and folks tell them what they want to know. They want to know about taking away the keys. They want to know about falls. They want to know about, yes, the brain thing. But our UGA folks eat the barbecue. They say, go dogs. And they build that trust that is so critically important. And slowly they are tagging in with our dementia care specialists, because those coalitions are not a one and done visit, my friends. That is something that stays in those communities. So where we have our dementia care specialists, they're tagging into those so that that group does not have to reinvent the wheel. And across all of these things, are they immediately talking about risk reduction for brain health? No, they're not. They're absolutely not, because that's not what the community asked for first. But when the community asks, and they have every time so far, they know what information to bring in. Everything on the slide is absolutely from UGA Care. They bring in the community members, their first responders, medical staff, pastors, and clergy, and they encourage them to have a conversation, and they facilitate and document that conversation. They've got a lot of great programming that they're working on. They've got a brain health program called Care Aware that they're currently piloting, which is very much also about risk reduction. But they're doing so and have decided to do that type of programming at the behest of local communities, which is incredibly powerful. And we're really, really proud to have them in our state doing that work. Their care is called Cognitive Aging Research Center program. They are not just looking at brain health at the 65 and older population. This is brain health at every age. And I just want to say that as somebody that works in injury prevention, we have brain health for infants, and that's about developing the brain, right? Getting the sponges that we are as littles and soaking in and having a healthy brain and a healthy start to life. To latch on to that and have a healthy brain across the lifespan, I think is a natural next step. Folks are really ready for that, to have that sort of healthy brain approach across the lifespan. And we're really proud that UGA is taking that seriously as they're working on it. So they're working on all of these types of things, as well as gearing up to see some patients, which is exciting. So I said earlier that libraries are the answer. They are. And so the reason libraries are the answer is because they're one of our most innovative partnerships. We worked with them to create a fall prevention nature walk, looking to increase public awareness, understanding the risk of falls and how to reduce that risk, and increase awareness of available community programs. I believe there's an article that came out at the end of September in JAMA about having a fall and then increased risk of dementia being diagnosed within a year of that fall. Very, very timely, very important to what we know. And we can talk about a fall, right? There's a lot less, now there's stigma about having had a fall, because that means you are somewhat frail, somewhat fragile. You don't want to talk about that and losing your independence. But as a topic, what we can come in and talk about as health educators with a fall, very easy to talk. Folks are very willing to talk about this topic. So Cobb County Library has something called Story Walk. This is actually a part of Let's Move Libraries, which is a national movement. And it's about taking fun storybooks and putting them on garage sale type signs and sticking them on a path. You can read a fun little story with your kid. You get to go outside and be active. You get to move. We took that concept and said, well, let's do that, but not have it be a fictional story. Let's tell a story of risk reduction and what it looks like to why we want to have fall prevention. So here's a couple of examples of those slides. We're welcoming people to the Fall Prevention Nature Walk. We're talking to them about falls applying to everyone across the lifespan because it does. We talk about brain health and fall risk and what that means. Some transition slides. And I keep saying slides because that's the world we live in, folks. Please understand that this is a menu sign that is, what is that, 4 foot by 2.5 foot wide, and it stands about this tall on a path, which you'll see in a moment. Talking about medications, talking about healthcare providers. There are QR codes on every single one of these boards. It takes folks to the resources that are right there in front of them. You can do these indoors and outdoors. They had some rainy season in East Georgia and decided they didn't want to fool with it being outside, so they stuck them on easels. There are 24 boards in this set, so it's not a small installation, but they had a lot of fun with it, which was great. This is what the boards look like in a park. They are typically done in the fall and the spring because that's when the weather is most helpful to be able to be out and have the boards do well. We've had great feedback on this. You can actually attach things to the boards if people were to want to take paper. Nobody takes paper, but they do use the QR code. So that is what we're doing in Georgia. It's a small snippet, but getting us to talk about fall prevention gets us to then have larger discussions about brain health and what could be done next in that community. And our partners are really excited about that. So I will turn it over to our Wisconsin speaker.
Megan, if you are there, we'll switch
here.
over to you now.
Welcome. Can you hear me okay? Thank you. Do you hear me okay?
Yes, we can hear you. Great.
Okay, perfect. Thank you for inviting us to be here. I'm thrilled to share on brain health initiatives from the Village of Greendale. You can go to the next slide right away. So the Village of Greendale is part of the Milwaukee metropolitan area in southeast Wisconsin, and was established in 1938 to showcase a new kind of suburban living with homes conveniently located within walking distance of gardens, schools, employment, and our village center. According to the U.S. Census Bureau, Greendale consistently has a higher percentage of older adults compared to Milwaukee County and the state of Wisconsin. Our population is just under 15,000 residents, and our residents are known for their strong sense of community. So our rich history really makes Greendale an inviting place to live, where many individuals have grown up and choose to age in the community, with some being second or even third generation residents. Our population historically has been predominantly white, but we are seeing increasing diversity with more residents from various racial and ethnic backgrounds. Just a little bit about our health department. We are a staff of 5, so we are all more or less aware or involved in everything that's happening in the department. And our vision is a healthiest and happiest Greendale. You can go to the next slide. I just wanted to note before I share the rest of the slides that these are not indicative of all of the programs and initiatives that we have done over the years. I kind of had to pick and choose to narrow it down. So from the beginning, one of the initial factors that started our work was our public health nurses they identified that they were getting more community referrals from families needing support and resources for their family members with dementia. Dementia was also identified as the second or third leading cause of death in Greendale, and that was like on a year-to-year basis, it was like flip-flopping. We felt that that data warranted more resources and work than it had previously received in the past. And as well, we knew that the risk of developing dementia increased as you got older, especially after age 65. So for those of you who aren't aware, or maybe you all are, local health departments are required in Wisconsin state statutes, indicate that we have to perform a community health assessment or a CHA and implement a community health improvement plan, which is what I will refer to as a CHIP every 3 to 5 years. And one priority area that resulted from our 2015 community health CHA was healthy aging. And SAGE, which is Successful Aging in Greendale. They're one of the work groups, has been together since that time. Around 2018, our staff and the SAGE work group started a subcommittee of SAGE to focus solely on dementia. They wanted to more formally coordinate the work that was taking place and resources related to dementia that were being developed in the area. So things that were happening and things that they supported and promoted were Memory Cafe, support groups for individuals living with someone with dementia, music and memory program, and then we partner with our Aging and Disability Resource Center on a frequent basis to provide memory screenings. And as a result of this increased coordination, we were accepted as a dementia-friendly community. You can go to the next slide. All right. So during their research, they discovered, and I say they because I was not a part of this work, so I'm just telling the story. I could have led with that as well. I apologize. They discovered the CDC and Alzheimer's Healthy Brain Initiative Roadmap for Public Health. They were inspired by the strategies and plans outlined in the roadmap and applied for the HBI grant, highlighting our community's dementia-related initiatives. Although they didn't receive the grant, their efforts were recognized and they were asked if the community would be interested in expanding our work in dementia prevention. And we were offered the opportunity to participate in the community convening process. So from this strategic planning process, 3 new work groups were formed. One was for brain health equity, another was youth focused, and the third one was on community health and wellness. So many members of these new groups were also involved or a part of our current CHIP. Unfortunately, a few months later, our former public health manager who championed this work retired. And with our existing meeting schedules and workload, it just became unsustainable for us to focus on our current priority areas while supporting the new groups. So we were more or less meeting to information share and coordinate more meetings, and there was not as much action being taken in the short time frame after her retirement. So my work in this space began shortly after community convening, shortly after the retirement. And as the public health strategist, I support all of our CHIP work groups, including SAGE. So I personally feel very compelled to work in this space, and I feel really grateful that I've had the opportunity to continue the work of our former public health manager and champion the work. I first learned about the HBI Roadmap Grant in an email from NACCHO, and I was really excited about it, given the enthusiasm around prevention-focused brain health initiatives that came out of the community convening. So it really wasn't until that point that I personally learned about our department's prior application, and I knew we were ready to take the next step and apply again. So we did receive the HBI funding, and the idea was to weave our project into our CHIP with the goal of raising awareness, educating the community about brain health across the life course, and strengthening public health infrastructure's understanding of dementia and how public health can play a role in addressing it. You can go to the next slide. So after being awarded the HBI funding, we held our first annual CHIP Summit. This was a gathering of about 30 individuals from our CHIP work groups, some members of our Board of Health, and other community partners and organizations. And the goals were to educate them on dementia risk reduction strategies and highlight public health's role in prevention, as well as a focus on equity. We really lean in to our partnerships, and we more or less need them to help be champions in the community so we can have a greater impact and reach more individuals. From that point, following the CHIP Summit, we integrated brain health and equity strategies into each of the work group's strategic plans as a way to restructure, refocus our community convening groundwork. Those strategies were to provide information to the Greendale community about how to protect brain health and decrease the risk for dementia, to increase access to programs and resources for all members of the community, and to promote opportunities to protect cognitive health. We've also built risk reduction into our staff performance management program by including training materials for new students and staff as a part of their orientation process. This includes educational videos created by the Alzheimer's Association that are specifically tailored for public health. This seemed especially important in my mind, that it become a more official part of onboarding in order to continue prioritizing brain health and expanding our public health knowledge. Additionally, our staff have been brainstorming and sharing successes and challenges with other health departments and municipalities across the U.S. Finally, our leadership actively supports staff participation in webinars and ongoing learning related to dementia risk reduction. Oh, I wanted to make one other note here. We just started our next community health assessment cycle, and my intention is to advocate and incorporate a question in our CHA related to dementia. I just haven't determined what that's going to look like yet. All right, you can go to the next slide, please. Okay, since we are a small community, we have no zip code specific baseline data related to dementia. We've conducted a 5-question dementia knowledge and attitude survey. We really wanted to find out whether community members knew that dementia was not a normal part of aging, as well as if they found out they had dementia at an early stage, would they be motivated to have a healthier lifestyle to potentially slow the progression of the disease, and whether they knew physical activity and nutrition played a role in reducing dementia risk. So this survey, we outreached with this survey in tandem with our other outreach and the other programs. Some other examples of outreach included revamping a handout on the MIND diet and having it translated to our most commonly spoken languages after English, which are Arabic and Spanish. We use, and is very well received, a healthy lifestyle habits handout from the NIH, which we would love to have in additional languages. We participated in several health fairs and outreach at our downtown farmers market. We published articles in our Life in the Village community magazine that goes out to all residences. We highlighted the risk factors in those articles while also promoting upcoming classes, events, and opportunities either related to brain health or for social engagement. We took out an ad in the same magazine, and we used the slogan, "What's good for your heart is good for your brain," which explained the actions of maintaining a healthy weight, not smoking or never starting, monitoring blood pressure, and staying physically active. Overall, really trying to stay positive and let people know what they can do and not tell them what they can't do or should not do. Additionally, we created a web page specifically focused on brain health, and we utilize our Park and Recreation Guide to advertise for our programs. You can go to the next slide. All right, so the messaging and outreach slightly overlaps with some of the programs. They're kind of intertwined. I just wanted to talk about a few of them. So focusing on brain health really provides a fresh and exciting perspective for our existing health services and programs. The slide just highlights some of the key areas where we intentionally incorporated brain health information and risk reduction strategies. Our goal was to be intentional and elevate brain health wherever we could. And an example of that is our bike helmet program. We were able to distribute bike helmets and perform fittings while giving participants, primarily, we do all ages, but parents with children, information about traumatic brain injury prevention and the connection to dementia risk. We have a fall prevention program and our public health nurses that our public health nurse facilitates. There's always a lot of participation, and there is some information that is shared as part of the group. Someone will just bring up the topic of, oh, did you know that this also is protective of your brain by, participating in these fall prevention programs. We also created a mini grant program to support shared decision making and leadership within community groups. These community groups were unintentionally promoting dementia risk reducing activities that we really wanted to help them elevate. Two of the groups were the Greendale Schools Garden and the Greendale Children's Garden. We supported them with a small amount of funding. Really, since the gardens are such a key strength in our community, we wanted to leverage that to increase our efforts on brain health. So one of the activities that we held with the Greendale Schools Garden, we hosted a salad building demonstration at our Greendale Senior Social Club, where participants learned about healthy eating patterns that support brain health, and then had the opportunity to practice what they had just learned by building a healthy salad for lunch with fresh garden produce. We also hosted a summer social event in the Greendale Schools Garden. In this collaboration, our staff was able to present brain health curriculum from the Department of Public Instruction and on brain health nutrition to culinary arts, the high school culinary arts and baking and pastry students, who then use that information to develop recipes, cook, and co-host a social event in the garden, which was open to the community. Lots of parents were there, and we were able to set up a nice display with more brain health information, hoping to engage the parents. We are running that event this year. Unfortunately, I was not able to coordinate with the new instructor to be able to come into the school to actually present on the brain health curriculum. So I was a little disappointed with that, but I know that everyone is really competing for time for things. I also facilitate an evidence-based 8-week brain fitness and education program designed by Mather Lifeways called Boost Your Brain and Memory, where the participants learn about cognitive reserve theory, adopting healthy habits, reviewing memory strategies, and practicing goal setting, all while developing a social network within the 8 weeks of the class. I still see participants in and around the community together with members of their same cohort. I like the idea of this class. Unfortunately, I feel like it's slightly outdated and would love to see something like this revised. So for many years, our health department has partnered with our community gardeners to facilitate a produce donation program. Over this summer, children who are enrolled in our Park and Recreation Child Care Program worked with gardeners to water, weed, harvest, package, and deliver produce to the Greendale Senior Social Club participants. This summer alone, the garden donated 187 pounds of produce to members of the club. We also advocated and assisted with the implementation of accepting food share benefits at our downtown market to increase access to fresh foods for families in our community, as we've been having increasing numbers in our local data showing that more support is needed in this area. As of recently, we've had the opportunity to enhance the built environment in what was many years ago an underutilized grassy space in our community, which is now the children's garden area. We've been able to help elevate it to promote social connection and community gathering by adding a pergola. We purchased picnic tables and a message center, and we've helped to increase accessibility by adding a more permanent water line for the volunteers and gardeners, purchase a storage shed so they don't have to haul in their tools, and we've created an accessible garden area with concrete slabs and raised garden beds to encourage gardening for all ability levels. You can go to the next slide. I just wanted to share a few lessons learned and wrap up with a couple of things. I wanted to highlight the power of partnerships. They've really been essential in driving our brain health initiatives forward. Just collaborating with a diverse community organizations, schools, and local group has really helped us expand our reach, share resources, and make a larger impact than we could have alone. Leaning into community strengths. So every community has their unique strengths. We've really found success by leveraging those assets. It was once suggested to me to focus on low-hanging fruit, and I have fully embraced that. Really building on what's already there and not necessarily starting from scratch has really been a key strategy for integrating brain health for us. Creativity and intentionality are key. Promoting brain health can be challenging as it often competes with other pressing public health issues that seem more immediate. I feel like to prioritize it effectively, we've had to be very creative and intentional at the same time, really embedding the brain health into existing programs and services and continually seeking new opportunities to do this and to do these things in meaningful ways. And then the biggest challenges I perceive are really fighting social and cultural norms, individual readiness and desire for behavior change earlier in life. And then I'm sure, as was said, the funding is always an issue because we don't receive any chronic disease funding. It does help us elevate these things, but I know there's not grants for everything. So anyway, thank you. That is all I have for you.
Great. Thank you, Megan. So we will keep you both here because we're going to go to questions. As we pull down the slides, I just want to start a couple of quick questions while everybody on the advisory council is thinking of other questions too. One of the things that I heard across both of your presentations was certainly integration with other types of programming within the Department of Health and inclusion of multiple stakeholders as you roll out these programs. You know, one of the things though that I was really struck about is the integration of that messaging within multiple areas. And I think that would be a great piece to really hear a little bit more from both of you on. You know, Liz, you talked about various ways people can improve their brain health or keep their brain strong. And have you seen anything resonate, especially as you partner with other departments or unique departments in motivating others?
So we did a couple of different introduction sessions between chronic disease prevention manager staff, which sit in the health districts in Georgia, and the concept of our dementia care specialists. And while we did that, we were showing them available materials that they could use. The goal is obviously to not reinvent the wheel. And so our coastal district, rock stars and all that they do, they are actually now working hand in hand with their dementia care specialists. They do a couple of different, I think, diabetes management, and I want to say hypertension is their other focus. I hope I didn't get that one wrong. But what they've done is they've started incorporating all of our brain health materials into that work. And they're thrilled. They're like, we drank the Kool-Aid. It's amazing. We want to do it, because they're already doing the work. They don't have to go and find another 5 to 15 hours in their work week to do this. So they've been really thrilled with it. And yes, to the point my colleague in Wisconsin made, competing priorities are tough. Had a little thing called COVID just happened. So, there's still effects from that. We're still working on that. Georgia's been slammed with natural disasters. We're tired. But in that, to be able to incorporate something that is plug and play into the work you're already doing has been amazing. We're hoping that we can have some of our health departments that work on chronic disease management incorporate into their nurse protocols, because that's what Georgia nurses work off of, brain health and fall risk reduction type of things, so that they can be asking those questions. But that's really early.
Right. Thank you. Megan, anything that you have seen that resonates more than another type of communication strategy?
I honestly think the face-to-face, one-on-one conversations that we have, like at our downtown markets, tend to be some of the most impactful, as well as information not necessarily coming directly from us, but as I mentioned, we lean on a lot of our partners and work group members to be the champions for us. I feel like they sometimes can do a better job because they don't necessarily have the public health background and are not thinking more data related or using necessarily more jargony kind of words. That they can deliver it a little bit better, but I do sometimes worry about the fidelity of the information, not trying to misinform anyone. I know that there is a certain learning curve to it, but I do feel like that has worked very well for us.
Megan, you also have a unique experience in that the village of Greendale is small-ish, with a population of only 15,000. I think we often hear that small communities don't feel like they have the resources. Or think to themselves, they don't have the capacity to take on an issue like dementia. What advice would you give those communities?
Just really what I shared at the end of the presentation. Consider maybe unusual partnerships that you wouldn't necessarily think of. Do the landscape assessment, see like what's happening in the community. I did give another presentation specifically about food access and the social determinants of health. And I just feel like there was so much happening in the community since 2011, I think it was, with our community gardens and nutrition, and in the schools, like involving so many parties, and it has evolved into something so beautiful, like looking at it from, however many years later. But if you're just starting out, if you can kind of see those things ahead of time, I think like, if earlier on we could have incorporated more, dementia information, how much more powerful that could be. Obviously we, can learn and do better, but so really just kind of see what's out there and see where you can kind of integrate.
Yeah. And Liz, you have some rural communities that you're also covering. Any additional thoughts on that front too?
Your rural communities will lead what they want you to know. I cannot come in from the state of Atlanta to South rural Georgia and tell them what to do. So the absolute best thing that we can do is to be that bridge and empower our partners. The more we talk about it, the more they want to go out and do the things. So I grew up in a small town. I get it. And in terms of rural anywhere, they might not talk to you, but they're doing the work once they've committed to it. So you just have to trust in that, because they've trusted in you to give them some materials to work with.
Thank you. Mm-hmm. Thank you both. Richard, did you have a question? Sorry, that was a legacy question from the last time. Any other questions? Okay. Liz, Megan, appreciate the time and effort that you gave to us here and the great work that you are doing from the Risk Reduction Subcommittee. As I mentioned, but you might not have heard, Dr. Lamont and ASPE overall has requested us to take a full year approach to our presentation. So this is a 1 hour time frame for you to hear from the risk reduction subcommittee, but you'll get to hear from us at every meeting. And so repetition is going to be on our side as we think about brain health and risk reduction activity that we can all be doing. So thank you again to both of you. And we'll have another conversation next time around on risk reduction subcommittee work.
Thank you.
Thank you for closing out that part of the session today. And I'm proud of Georgia. That's all I can say. Within GUARD, our Georgia Alzheimer's and Related Dementia Task Force, it's a lot of energy. It's so many people that we have all these subcommittees, and they're very, very busy too. But we're a whole state, and to see all that replicated in Wisconsin, it's like, oh, okay, we're not the only ones that can do all of this. So it's our charge out to the rest of the states, for sure. So we're going to take a 5-minute break, and then we're going to go into our public announcements. 5 minutes. Thank you.
Produced by the U.S. Department of Health and Human Services.